If you're over 60 and your legs feel heavy, weak, cold, numb, or painful, please listen carefully. What you are feeling is not just old age, and it is not something you should ignore. Millions of seniors across the United States wake up every morning with stiff legs, burning feet, tingling toes, or pain that starts after walking only a short distance. Many of them are told the same thing again and again. Take magnesium. Walk more. Accept it. This is normal aging. But what if I told you that for many seniors, magnesium is not the missing piece? What if the real problem is something far more basic and far more dangerous to ignore? Today, we are talking about leg circulation after 60 and the one vitamin that supports it more than anything else. Not magnesium, not calcium, not potassium. This vitamin directly affects your blood, your nerves, and your ability to walk without pain. And if you are deficient, which most seniors are, no amount of walking or stretching will fully fix the problem. Let's start with the truth. As you age, your legs are the first place where circulation problems show up. Why? Because your legs are farthest from your heart. Blood has to travel downward, fight gravity, pass through narrowing vessels, and still deliver oxygen and nutrients to muscles and nerves that work all day long. When circulation weakens, your legs suffer quietly at first. You may notice your feet feel colder than they used to. You may feel tired after standing. You may feel pain in your calves when walking that disappears when you rest. You may feel tingling, pins and needles, or numbness in your toes. Many seniors ignore these signs because they come slowly, but slow problems can lead to serious outcomes. Poor leg circulation increases the risk of falls, loss of balance, nerve damage, chronic pain, loss of independence. And once nerve damage becomes advanced, it is much harder to reverse. Now let's talk about why circulation gets worse after 60. First, blood vessels naturally become stiffer with age. Healthy blood vessels are flexible. They expand and contract easily to push blood forward. But with aging, inflammation, blood sugar issues, and oxidative stress, those vessels lose elasticity. When vessels stiffen, blood flow slows. Oxygen delivery drops. Waste products build up. Your leg muscles do not get what they need to function properly. Second, nerve signals weaken. Nerves control sensation, balance, and muscle movement. They depend heavily on good circulation. When blood flow drops, nerves are starved of oxygen and nutrients. This causes tingling, burning sensations, numbness, weak muscle signals. This is why many seniors say, "My legs feel alive but dead at the same time." Third, and this is critical, nutrient absorption declines after 60. Even if you eat well, your body does not absorb nutrients the same way it used to. Stomach acid decreases with age. Digestive enzymes weaken. The body produces less of something called intrinsic factor, which is essential for absorbing certain vitamins. This leads to hidden deficiencies. You may have normal blood pressure. You may eat protein. You may take supplements. And still, your body may be starving at the cellular level. Now, let's talk about magnesium. Magnesium is often recommended for leg cramps, muscle relaxation, and sleep. And yes, magnesium has benefits. But magnesium does not rebuild damaged nerves. Magnesium does not correct oxygen delivery problems. Magnesium does not support red blood cell production. That is why many seniors take magnesium for months and feel little to no improvement in circulation symptoms. The problem is not muscle relaxation. The problem is blood and nerve function. And this brings us to the one vitamin that most seniors are dangerously low in, vitamin B12. Vitamin B12 is not a trendy supplement. It is not new, but it is one of the most misunderstood vitamins in senior health. Vitamin B12 is essential for three things that directly affect leg circulation: healthy red blood cells, strong nerve protection, cellular energy production. Without enough B12, your legs cannot receive oxygen efficiently. Your nerves cannot send clear signals. Your muscles cannot generate energy properly. This is why B12 deficiency often looks exactly like poor circulation. Let's talk about red blood cells first. Red blood cells are responsible for carrying oxygen from your lungs to every tissue in your body. Your leg muscles are large and active. They need a steady oxygen supply. Vitamin B12 is required to produce healthy red blood cells. Without it, red blood cells become weak, misshapen, and inefficient. When this happens, less oxygen reaches your legs. Muscles fatigue quickly. Walking becomes painful. Legs feel heavy and weak. This is not something magnesium can fix. Now let's talk about nerves. Vitamin B12 protects a myelin sheath, the protective coating around nerves. Think of it like insulation around electrical wiring. When that insulation is damaged, signals become distorted or lost. Low B12 leads to tingling, burning pain, numbness, loss of coordination. Many seniors think this is just neuropathy or just aging, but often it is a B12 deficiency. And here is the most alarming part. Nerve damage from B12 deficiency can become permanent if ignored too long. That is why early correction matters. Now let's talk about energy. Every movement your legs make requires energy at the cellular level. Vitamin B12 plays a role in converting food into usable energy. When B12 is low, muscles feel weak, legs feel heavy, balance worsens, walking endurance drops. This is why seniors often say, "I feel tired just standing." So, why are so many seniors deficient in B12? It is not because they are careless. It is because aging changes the body. After 60, the stomach produces less acid. B12 from food requires acid be released and absorbed. Many seniors also take medications that block acid, such as acid reflux medications, heartburn drugs, certain diabetes medications like metformin. These medications save lives, but they also block B12 absorption. Even seniors who eat meat and dairy can become deficient. And here is something most doctors do not explain clearly. A normal B12 blood test does not always mean your cells are getting enough B12. You can be functionally deficient, meaning symptoms are present even when lab numbers look acceptable. This is why so many seniors suffer quietly. In the next part, we will talk about the exact symptoms of B12 deficiency that affect leg circulation, how to recognize them early, and why ignoring them can cost you your mobility. Stay with me. If you are listening to this and thinking, "This sounds like me," you are not alone. Vitamin B12 deficiency is one of the most common underdiagnosed problems in seniors over 60, and the symptoms often appear first in the legs. Let's go through them carefully. One of the earliest signs is cold feet. Your feet may feel cold even in warm rooms. Socks do not help. Blankets do not fix it. This happens because blood is not reaching the smallest vessels efficiently. Another common symptom is tingling or pins and needles. This sensation often starts in the toes and moves upward. It may come and go at first. Then it becomes constant. This is not just circulation. This is nerve irritation from lack of B12. Next is burning pain. Many seniors describe a burning or electric sensation in their feet, especially at night. This is often misdiagnosed as diabetic neuropathy alone. But even non-diabetics experience this when B12 is low. Then there is leg weakness. You may feel unsteady. Your legs may feel like they will give out. Stairs become difficult. Standing from a chair takes more effort. This weakness is not laziness. It is cellular energy failure. Another major symptom is pain, while walking that improves with rest. This is sometimes called claudication. It happens when muscles do not receive enough oxygen during activity. Low B12 worsens this problem by reducing oxygen delivery. Many seniors also experience balance problems. You may feel off balance in the dark. You may feel unsure on uneven surfaces. You may trip more often. This is extremely dangerous because falls are one of the leading causes of injury in seniors. Now here is the scary part. Many seniors experience these symptoms for years without treatment. They think, "It's just old age. It runs in my family. There's nothing I can do." But B12 deficiency is not inevitable, and it is often reversible if addressed early. Now, let's talk about the right form of B12. Not all B12 supplements are equal. The most effective form for seniors is methylcobalamin. This is the active form your body can use immediately. Another important factor is how you take it. Swallowed pills rely on digestion and stomach acid, but many seniors lack sufficient acid. That is why sublingual B12, tablets or drops dissolved on the tongue, are often more effective. They bypass digestion and enter the bloodstream directly. This is especially important if you are over 60, take acid blockers, have digestive issues, have diabetes. Now let's talk about dosage. For many seniors, a daily dose of 500 to 1,000 micrograms is commonly used. Vitamin B12 is water-soluble. Excess amounts are excreted in urine. However, you should always speak with your healthcare provider, especially if you have kidney disease or complex medical conditions. Consistency matters more than high doses. B12 does not work overnight like a painkiller. It works gradually by repairing systems that take time to heal. Most seniors who respond well notice warmer feet within 1 to 2 weeks, reduced tingling within 3 to 4 weeks, improved walking endurance in 1 to 2 months. Now let's talk about something important. Vitamin B12 works best when combined with healthy circulation habits. This does not mean intense exercise. Simple daily movement is enough. Gentle walking helps pump blood back to the heart. Ankle rotation stimulates small vessels. Calf stretches improve blood flow. Hydration is also essential. Thick blood flows poorly, and smoking, if present, severely restricts circulation. In the next part, we will talk about real-life senior experiences, common myths about B12, and why ignoring leg circulation problems can cost you your independence. Let me share something important. Many seniors who improve their leg circulation with B12 never expected it to help. They tried magnesium. They tried creams. They tried walking through pain. Nothing worked until the deficiency was addressed. One senior gentleman in his early 70s complained of burning feet and leg pain after short walks. Magnesium helped his cramps slightly, but the pain remained. After correcting his B12 deficiency, he noticed something surprising. His feet felt warmer. His balance improved. His walking distance increased. This is not a miracle. This is biology. Your body cannot function without the nutrients it needs. Now, let's clear up some common myths. Myth 1. Only vegetarians are low in B12. This is false. Absorption declines with age. Diet alone is often not enough. Myth 2. If my blood test is normal, I'm fine. Symptoms matter. Functional deficiency exists. Myth 3. This is just aging. Aging increases risk, but deficiency is not inevitable. Now let's talk about why ignoring leg circulation is dangerous. Poor circulation increases fall risk. Falls lead to fractures. Fractures lead to loss of independence. Nerve damage can become permanent. Mobility can be lost. And once confidence in walking is gone, quality of life suffers. Correcting B12 early is one of the simplest ways to protect mobility. In the final part, we will talk about long-term protection, daily routines, and a final message for every senior listening. If you remember only one thing from this entire message, remember this. Poor leg circulation is not something you should ignore, and magnesium alone is often not enough. Vitamin B12 plays a direct role in blood oxygen delivery, nerve protection, muscle energy. Deficiency is common after 60. Symptoms are often subtle at first, but consequences can be severe if ignored. Your legs carry you through life. They deserve attention and care. Talk to your healthcare provider. Ask about B12. Pay attention to your symptoms. Simple steps can make a real difference. If this message helped you, share it with someone you care about, because good circulation means independence, and independence means quality of life.